Welcome. You're watching the Daily Report for Thursday, October 28th here in Korea. I'm Min San-hee. With the majority of people on the local front fully inoculated, questions related to COVID-19 vaccines are mounting. So in our broadcast today, we aim to address these questions after a look at the global pandemic updates with our Kwon So-ah. So just start us off here on the local front then.
Sure, Sunny. We were hoping to not surpass the 2,000 mark before transitioning into our Living with the COVID-19 scheme. But it did happen this Thursday as 2,111 cases were tallied as of 12 a.m. And that includes almost 2,100 domestic transmissions with 16 cases from abroad. Now, it's not a huge jump from yesterday, as you can see here, but compared to last Thursday, we've got around 670 more COVID-19 cases. And with that, the average number of domestic transmissions in the past week has now surpassed 1,530. Now let's move on to our map here. The capital Seoul has posted an increase and Gyeonggi-do province a downward figure, but both are still in the 700s. Meanwhile, Daegu here with 106 cases reported has jumped to the triple digits for the first time in around a month. Now, Korea has accumulated 358,412 infections so far, and with 11 additional deaths, the death toll stands at 2,808. We've also got almost more than 900 additional people now under treatment or in quarantine. Now let's move over to our vaccination updates. 40.97 million people have received at least one shot, and 36.97 million have been fully vaccinated as of 12 a.m. this Thursday. Let's take a look at global figures now. A rise by around 493,000 new infections as of noon Korea time, with an additional 9,041 fatalities reported in the same span. Let's move over to the countries with the highest number of infections. Now, in the past week, the WHO says that the U.S. has seen an increase by around 12% of new infections, and also there was a similar increase in other parts of the world, such as the UK and Russia and Turkey. These are still seeing more than 20,000, 30,000, and like the UK, around 40,000 infections in just a day. And those are the general updates that I have for now, but I'll see you back in a bit. Sunny?
All right, so thank you for now. Right, now let's take a closer look at the COVID-19 developments on the local front, especially in light of the recent spikes in daily infections, as our So-ah mentioned earlier. I have Min Jung here in the studio. Min Jung, welcome.
Thank you for having me.
Right, so Min Jung, I hear the highly transmissible Delta variant is the dominant player on the local front. Tell us more.
Right, last week, South Korea saw more than 3,300 variant cases, and all but one were attributed to the Delta variant. When looking at locally transmitted variant cases only, the Delta accounted for 100% of all infections. On top of this, Korea has reported a total of nearly 20,000 breakthrough infections. This is equal to 0.074% of fully vaccinated people. Most were in their 30s and those who got the Janssen vaccine.
I see. Now, also, Min Jung, health authorities here have reiterated their concerns over a possible twindemic, right?
Right. So on Wednesday afternoon, in a briefing, they once again expressed concerns over a potential uptick in the number of cases fueled by a drop in temperature. So it's almost November and we're approaching winter, and health experts say it could allow the virus to spread much more easily than during the warmer months of the year. On top of that, we're also approaching the flu season, so authorities are not letting their guard slip. Let's take a listen.
COVID-19 and influenza are respiratory viral diseases with similar symptoms. When a patient with a fever visits the hospital during the winter, it's more difficult to differentiate the viruses. We ask the public to actively participate by getting vaccinated against influenza as well.
And there's a third factor, Halloween. It's that time of the year when young people go out to mingle with friends and let their hair down.
Right, well, given the words of caution by authorities here, hopefully the public will partake in safe and responsible celebrations. Meanwhile, Min Jung, what is the latest on our inoculation front?
Right, so until now, 7 out of 10 people in South Korea have been fully vaccinated, and most are adults. But the country is now forging ahead with vaccinations for teenagers as well. Among 16 and 17-year-olds, more than 62% have booked their vaccine appointments, and 28% have received their first doses. For those between 12 and 15, just under a quarter have made their bookings. As of now, the country has not authorized vaccinations for kids under 12. Meanwhile, over in the U.S., FDA advisors voted unanimously in favor of approving Pfizer's vaccine for kids aged 5 to 11. Now, turning our focus back home, Samsung Biologics on Thursday began distributing Moderna vaccines produced under contract here in Korea. This is the second type of COVID-19 vaccine to be manufactured and used locally by Korea. Some 2.4 million doses will be supplied to the country to vaccinate people in the fourth quarter.
Right, Minjung, that is good to know. Now, one final question before you go. What can you share with us about treatment efforts?
Well, the government signed a contract to purchase oral COVID-19 treatments, enough for 400,000 people. This is 10 times more than what was originally planned. Korea has been negotiating with overseas pharmaceutical companies with the aim of bringing in oral treatment drugs early next year. The details of the latest agreement will likely be announced on Friday. Currently, Merck is awaiting for approval for its oral antiviral treatment Molnupiravir from regulators in the U.S. and Europe. The company has also decided to share licensing for the treatment with a UN-backed nonprofit organization to allow more companies to manufacture generic versions. The licensing agreement is expected to expand access to the drug in more than 100 countries.
Right, more than 100 countries. All right, Minjung, thank you for that coverage. I'll see you on Friday.
Thank you.
Right, rebounds in COVID-19 tallies are also being reported across the globe. For more on this reality, I have Sua back at the desk. Now, Sua, let's start then with the jump in daily cases over in Singapore.
Yes, Sunny. So Singapore posted more than 5,000 new COVID-19 infections. And this is not only the highest ever single-day caseload the country saw since the beginning of the pandemic, but it's also a jump from the 3,000s seen just the previous day. Now, Singapore's health ministry called this rise by more than 2,000 cases from the day before an unusual surge that occurred within a relatively short window. 4,651 cases were reportedly community spreads, 661 were traced to migrant worker dormitories, and a dozen were imported cases. The country reported 10 new COVID-19 related deaths among people aged in their 50s to 90s, with all but one of them having been unvaccinated. Singapore had adopted a living with COVID-19 strategy since July and has at least 84% of its population fully vaccinated. In the past 4 weeks, the country has been posting an average of over 3,000 daily cases, though, and that has prompted the country to pause reopenings and reimpose prevention measures until the 21st next month. That includes limiting social gatherings to 2 people. Once occupying the top spot in a COVID-19 resilience ranking, Singapore's shift to living with the virus is facing fresh hurdles, dropping by 20 places in October from the month before.
Right, I see. Meanwhile, so in neighboring China, I understand authorities there are also sternly trying to rein in potential outbreaks ahead of the Winter Olympics, right?
That's correct, Sunny. So while high vaccination rates and the decline in hospitalizations and deaths are leading to more countries gradually shifting to pre-pandemic lives, that's definitely not the case in China, which is, of course, the 2022 Winter Olympics host country. Now, 39 new cases were reported on Thursday, representing the numbers tallied on the day before, with 23 of them being local transmissions. It is a drop from 50 local cases the day before, when China started its 100-day countdown to the Beijing Olympics. At least 4 million residents are being forced to stay at home in numerous cities and districts under a mass lockdown in line with the nation's zero-tolerance policy. On Wednesday, Beijing announced special antivirus prevention measures for the international winter sports event that include simplified operation of games, remote prevention and control, vaccination, as well as management of possible loopholes, along with stern measures against violations of regulations. Here's more from the Vice Mayor of Beijing, who is also the Vice President of the Beijing 2022 Winter Olympics Organizing Committee.
We will strictly implement the relevant punishment provisions. Some details are being discussed with the IOC. Those who do not comply with the guidelines may face warning, temporary or permanent cancellation of registration, temporary or permanent disqualification, expulsion from the games, disqualification, and other serious consequences.
Right, a very tough line stance right there. Finally, so over in Europe, I understand infections there are showing little sign of abating.
Right, Sunny. I earlier briefly mentioned how there's been an increase by some 12% in the past week in the U.S. But if we compare some individual countries in Europe, there's been actually a 43% on-week increase in the Ukraine, according to the World Health Organization. Also, 16% increase in the UK, as well as 15% in Russia. So Europe is really leading the world in new COVID-19 cases and deaths in the past week. According to the WHO, the continent saw infections rise for the fourth straight week. An on-week rise by 18% in cases and 14% in coronavirus-linked deaths were tallied over the last week, with the situation in particular worsening in Eastern and Central Europe. Low vaccination rates appear to be playing a major factor. Russia on Wednesday recorded another high in single-day COVID-19 deaths of 1,123, with the capital Moscow to implement a partial lockdown starting Thursday. A nationwide workplace shutdown is also slated to kick off in the first week of November. Bulgaria saw a record high of 6,813 infections on Wednesday, struggling with a fourth wave of the virus. Meanwhile, Poland, the Czech Republic, and Hungary saw surges to 8,361, 3,125, and 6,274 cases, respectively, all three being record highs since the month of April.
I see. All right, Swadan.
And I just also want to mention that the European Union's Public Health Agency has also warned of the seasonal influenza this winter season, which could strain healthcare systems that are already burdened by the COVID-19 pandemic. So many officials there are asking for seniors and people that have weakened immune systems, as well as medical workers, to get vaccinated, not only for COVID-19, but also for the flu.
Right, the seasonal flu, which is something our authorities here in the country have also called out for, given concerns of the twindemic, right? All right, so as always, thank you very much for that. I'll see you again on Friday.
My pleasure.
Topping our headlines at this hour, President Moon Jae-in is poised to meet with Pope Francis at the Vatican before sitting down with his counterparts at the Group of 20 over in Rome this weekend. On his agenda are peace efforts on the Korean Peninsula and global efforts on the pandemic front. Our Kim Min-jae reports.
President Moon Jae-in is en route to Rome, the first stop on his 9-day tour of Europe. During his 3-day stay in the Italian capital, the president will meet Pope Francis at the Vatican to talk about ways to boost peace on the Korean Peninsula. This will be Moon's second meeting with the Pope. His first was in October 2018. Likely on the table for discussion will be a potential visit to North Korea by the Pope, who has expressed willingness to go if there's an official invitation from the regime. Attention will be on whether the meeting will also be able to reignite the stalled peace process. President Moon will then attend the G20 summit over the weekend. It's the first time that the multilateral event will be held in person since the start of the pandemic. On the agenda are climate change, COVID-19, and post-pandemic global recovery. On the sidelines, Moon is also expected to meet with U.S. President Joe Biden, although the timing and format has not been decided. From November 1st to 2nd, President Moon will be in Glasgow for the UN Climate Change Conference. There, Moon will give a keynote speech in which he is expected to unveil South Korea's new carbon emissions reduction target. Attention is on whether he will meet with Japan's new Prime Minister Fumio Kishida, who has expressed his intent to attend the COP26 summit. The final leg of Moon's tour will take him to Hungary for a 3-day state visit. Moon will first pay his respects at a memorial in Budapest to remember the 25 South Koreans who died in a boat accident on the Danube River in 2019. On November 3rd, Moon will have separate talks with the Hungarian president and prime minister, followed by a business forum with members of the so-called Visegrad 4 countries, which also includes Slovakia, the Czech Republic, and Poland. The next day, the president will attend the South Korea Visegrad summit to discuss ways to expand cooperation with the second-largest market in Europe. The Blue House expects a series of multilateral diplomatic events to serve as an opportunity to drum up support for the Korean Peninsula peace process and highlight South Korea's raised global status and its role in bridging advanced and developing nations in the post-pandemic era. Kim Min-ji, Arirang News.
And as part of efforts to drum up support for the peace process that my colleague Minji just mentioned in her report, Seoul's top diplomat met with his Russian counterpart earlier on Wednesday to highlight the importance of resuming dialogue with North Korea. Yoon Jung-min has more.
The two foreign ministers from South Korea and Russia have agreed on the need to resume talks with North Korea in order to continue the Korean Peninsula peace process. At a press conference after their meeting in Moscow on Wednesday, Seoul's foreign minister once again asked for Russia's constructive role for the denuclearization of the Korean Peninsula, calling Moscow an important partner.
We have agreed to closely communicate and cooperate at various levels for the restart of the Korean Peninsula peace process as soon as possible. We have exchanged opinions on various cooperation measures for the early resumption of talks with the North.
The Russian foreign minister said they had discussed the situation on the peninsula in detail, stressing the need for the resumption of dialogue by all related parties, possibly meaning the two Koreas, the U.S., China, Russia, and Japan.
We believe that a diplomatic solution should be possible and that talks should be resumed by all parties concerned. We need to ensure that no factors intervene that will lead to increased tensions.
A high-level official reportedly said Russian officials have also shown support for the Korean government's end-of-war declaration proposal. As for Seoul-Moscow ties, they have agreed to further expand relations in trade and the economy and continue to cooperate in 9 key sectors, including energy, infrastructure, and shipbuilding. They have also agreed to expand cooperation in overcoming the COVID-19 pandemic. Chung added they have agreed to work toward a visit to South Korea by Russian President Vladimir Putin as soon as the pandemic situation gets under control. Chung and Lavrov also attended a cultural event on Wednesday commemorating 30 years of diplomatic ties between the two countries. Yoon Jung-min, Arirang News.
The U.S. has taken a tangible step forward in support of gender-inclusive government policies. The State Department there has issued its first passport with an X-gender indicator. Kim Yo-sun has details.
The U.S. State Department has issued the country's first passport with an X-gender marker in a move to implement gender-inclusive policies. An intersex and non-binary Colorado resident, Dana Zim, was issued with the first American passport of its kind.
It's legal recognition for me and my community. Legal recognition means we have status as a human being instead of an issue.
In a statement Wednesday, State Department spokesperson Ned Price said the move is in line with the department's announcement in June that it's seeking to add an X-gender marker for non-binary, intersex, and gender non-conforming persons to select their gender marker for their passports. He also underscored the department's commitment to promoting the freedom, dignity, and equality for everyone. While the State Department did not say who the first X-gender passport was issued to, civil organization Lambda Legal confirmed its client Zim was the recipient. The option will be made available to routine passport applicants after the department completes its system and form updates early next year. With this, the U.S. joins countries like Canada, Australia, and New Zealand in introducing gender-inclusive passport policies. Kim Yo-sun, Arirang News.
On the corporate front, Korea's Samsung Electronics has charted a record-breaking performance for the third quarter. In fact, sales hit $63 billion for the first time. Our Min Soo-kyun has more on the company's latest gains.
Samsung Electronics has reported strong third-quarter earnings. According to the company on Thursday, sales topped $63 billion in the July to September period, up more than 10% from a year earlier. The figure is the best-ever sales result for the firm. The South Korean tech giant also recorded a third-quarter operating profit of $13.5 billion, up 28% on-year. This marks its second-highest operating profit following the third quarter of 2018 during the so-called super cycle when chip makers benefited from price hikes on rising demand. The strong performance was largely driven by its semiconductor business, which recorded an operating profit of $8.6 billion. This comes as the price of memory chips such as DRAM peaked in the third quarter, and sales in the non-memory chip and foundry sector saw increased profitability. But some industry watchers say that the gains from the chip industry boom may not continue in the fourth quarter.
Since shipments of semiconductors are likely to slow down and some DRAM prices are likely to fall, profits will drop for the time being after the peak of third quarter earnings.
Samsung Electronics said that the success of its latest foldable phones, the Galaxy Z Fold 3 and Galaxy Z Flip 3, played a part in leading the solid earnings, and so have sales of its small and medium-sized OLED panels. Min Soo-kyun, Arirang News.
Now, one core component in the making of semiconductors is ultra-pure water. And at the moment, Korea relies on its counterparts for this particular technology. Well, Samsung Electronics is looking to change this reality in the near future. Our Chang Tae-yeon tells us how.
This is ultra-pure water. While tap water contains natural electrolytes and salts, ultra-pure water contains just H2O and nothing else. Ultra-pure water is needed for making semiconductors, as any impurities will cause defects. About 1 liter of ultra-pure water is used to wash a 12-inch wafer. So as you can imagine, factories need a lot of ultra-pure water. And that is why semiconductor factories have their own water production facilities. South Korea's chip makers like Samsung Electronics rely on equipment from overseas to make ultra-pure water, and much of that equipment comes from Japan. And as relying on other countries can be risky, South Korea is developing its own domestic technology to produce the water.
If there are export regulations in the future, it could be hard to produce ultra-pure water, and that could disrupt semiconductor production.
The ultimate goal is to be able to fully produce ultra-pure water domestically by 2025. This will help make South Korea's semiconductor supply chain even more secure. Chang Tae-yeon, Arirang News.
A special exhibition is currently underway here in the country, much to the delight of those interested, as many events have been cancelled, postponed, reduced in size or turned remote amid the pandemic. Now, having said that, I turn now to Chun Sung-cho, who is at the exhibition. Sung-cho, good to see you again.
Good afternoon, Sunny.
So where exactly are you at, Sung-cho?
So I'm at the Kintex Convention Center in Goyang, northwest of Seoul, where the Robot World exhibition is taking place. It's the biggest international robot exhibition in South Korea. Each year, it brings together hundreds of companies together, and all of their companies are showcasing all of the latest state-of-the-art technologies. And this year, it's no exception. The venue is packed with people, as you can see, and all of them have come here to showcase their products or to be dazzled by the latest technologies. But of course, since we're in the middle of the pandemic right now, they had to follow public safety protocols before entering the venue. So they had to go through what's called the disinfecting gate, and they had to step in front of the camera for a body temperature check. But see, even the simple step of entering the venue involves so many different devices these days because we want to avoid avoid direct contact with other people as much as possible. And that is why robots have become an essential part of a war against COVID-19. All the companies participating in this exhibition all specialize in automation, artificial intelligence, and robotics. And now that all of their products are put together in one place, it looks more like a sci-fi movie to me, don't you think? So this first product that I want to show you right now is this robotic arm. So it's fast becoming one of the most important tools on the production line. It can be used for several manufacturing applications, including welding and material handling. It helps increase throughput while also removing workers from dangerous environments. And then next, the robot that I want to show you is this four-legged robot. All right, so it looks more like an animal, right? So as you can see, it has 4 feet. And it's said to be more versatile than wheeled products because it can traverse many different terrains. So they're exceptional at maneuvering in hazardous, challenging environments. Here is a worker from the company, so let me talk to him, ask him a question. 이 제품에 대해서 좀 소개해 주실 수 있으세요?
네, 이거는 사족보행 로봇이라고 불리는 것이고요. 이동하는 로봇입니다. 근데 기존에 이동하는 로봇은 대부분 바퀴 굴림 방식을 사용했는데요. 그런 바퀴 굴림 방식이 이제 한계점이 있습니다. 예를 들어 계단이라던가 둔턱이라던가 야지 이런 데 적합하지 않은 것이죠. 그래서 그런 한계점을 극복하고자 이런 사족보행 형태의 로봇들이 개발이 되고 있는 겁니다.
감사합니다. So like I said, it's more versatile than the traditional wheeled robots because they can go on different terrains like steps, and they can even step over different floors and different types of grounds. So this can be very exceptionally useful in rescue and search operations. So let me talk to another official from Kintex. 안녕하세요.
안녕하세요. Hi.
Hi, good afternoon.
Good afternoon.
So this exhibition is, of course, a platform where companies are showcasing their products and technologies, but I also heard that this is providing a lot of opportunities for the companies as well.
That's right. There are 160 companies attending this exhibition, including overseas exhibitors. Because international travel remains difficult amid this pandemic, we have prepared overseas business meetings with foreign buyers. Also, we hold Invest Day program to boost overseas investment to local companies.
All right, thank you so much for your answer. Thank you. All right, now it's jumping now. So even though it is a scaled-down version, this exhibition is full of surprising and exciting technologies, and it still managed to blow me away. Some people still worry about robots replacing humans' jobs in the future, but what's clear to me, at least today, is that our future will be much more efficient and safer thanks to these advanced machines. This has been Chun Sung-cho reporting live from Goyang, and back to Sunny in the studio.
All right, Sung-cho, thank you for that glimpse into the future. Broader COVID-19 vaccination coverage is prompting more questions about potential side effects and other related matters. So to answer some of those inquiries, I have Dr. Alice Hyun-Kyung-Tan from Miss Medi Women's Hospital. It is a pleasure to have you back, Dr. Tan.
Thank you for having me.
I also have Professor David Kwak from Sooncheng University. Welcome back, Professor Kwak.
Good afternoon, Sunny.
Dr. Tan, before we delve into today's issue of interest, let's start with a few words from you regarding the latest surge in daily infections here on the local front.
Right. So unfortunately, the daily caseload went above 2,000. We have to wait and see just to see if perhaps there was one particularly large cluster that accounted for a large number of these cases. But what we do know is week on week, the reproductive number had been increasing. So the end of September, it was 1.2, then it went down below 1 for a few weeks. And then last week, the reproductive number started to go up again. And so what this means is viral transmission may be on the upswing. Certainly if you go into retail spaces, restaurants, they are packed. And so it's not surprising that we're seeing numbers above 2,000 again.
Right. And Professor Kwok, what are the implications then of this recent spike in daily infections, especially in light of our efforts to transition into a new normal?
Well, the implication would obviously be the fact that we can never let our guards down yet. Even though if we decide to go into the new phase of living with corona, so to speak, I think it's not the best season to choose to do that yet because we're going into much colder season. And as we have felt in the past week or so, the weather has gotten much colder. I think people are definitely gathering more inside, and that exposes them to be transmissible to others, relatively speaking, compared to if they were to be on the outside. So the multiples of different factors are coming into place here. The fact that we're going into colder season and people will be a lot more gathering on the inside, and also the fact that by stating that we will go into much easier restrictions, people already had gotten themselves relaxed about their tensions against this fight against the virus. So I think this only iterates the point that unless we work together to really fight this virus off, there is always a chance that the virus to come back again, even within the original strain that it used to be, or even it can even possibly mutate itself to still attack us further. Now, I'm going to be a little bit long here, but if I may refer ourselves back to the Spanish flu once again, at the end of the second huge wave, which we still think it's the end of the pandemic then, they had a half of the amplitude of the second wave that came right afterwards. There's always that chance for us too. So even if we saw a numbers to drastically go down, it's not the best time still yet for us to let our guards down.
Right, so we need to remain vigilant.
Mm-hmm.
All right then, now, Dr. Dan, do tell us, we're going to move into today's topic then, do tell us a bit about the possible physical discomforts following COVID-19 inoculation.
Well, so we have very serious physical side effects, and then we also have not so serious side effects. Fortunately, the not so serious side effects are more common than the very rare serious side effects. The more common physical side effects include pain that you could have in the injection site, pain in the arms, swelling, redness, and then you have what we call systemic symptoms. So symptoms such as fever, chills, headache, muscle achiness, joint pain. I'm just thinking about what I felt, nausea, vomiting, fatigue. These can all be some physical side effects, and they do tend to occur more commonly in younger people than older people, and that's to be expected because these side effects, they show that the vaccine is working. If you have a very strong immune system that's mounting an immune response against the vaccine, you're going to have these side effects. And so actually it's not a bad thing to have these side effects, actually to feel them. It means that the vaccine is working. In terms of the serious side effects, we are talking about anaphylaxis, Guillain-Barré syndrome, thrombosis with thrombocytopenia syndrome, and myocarditis and pericarditis. Of course, myocarditis, pericarditis, thrombosis with thrombocytopenia syndrome, these tend to occur more frequently in younger people, and then the Guillain-Barré syndrome was found to be more frequent in men greater than the age of 50. So there is an age differential in these adverse events.
Right. Dr. Dan, I experienced absolutely no side effects after my own vaccination. Does that mean my immune system is sleeping?
No, I mean, maybe you just lucked out. I don't think that it means that there's no reason why your immune system would not have worked against the vaccine. Right. There are some people, though, with who are immunocompromised or who are very elderly. They do have a hard time mounting an immune response against the vaccines. And in these people, actually, the recommendation is to get a third additional dose. It's not called a booster. They actually need 3 doses to get full immunity.
I see. Meanwhile, Professor Kwak, there is talk, as Dr. Dan has mentioned, that such post-inoculation responses are indications of a very strong immune system. Could you tell us a bit more about that?
Right. So continuing on from what Dr. Tan was mentioning, so when we see much more frequent side effects in the younger generation, we try to explain it by saying it's because the younger generations, their immune system is stronger than the older generation. And I'm being careful not to completely characterize it only that way, because it may not explain 100% all the occurrences. For some people, like yourself, and like myself maybe too, even who could be considered younger generations could pass without a certain side effects, despite having been inoculated for the completion of the vaccination. It does not mean that you didn't have an immune response to the vaccine. It does not mean that you're no longer be protected from the virus even after the vaccine. It still means that you will be protected. So I'm being careful not to decide that it's 100% of the explanation. But there is a tendency for much older generations to weaken in their immune responses. So even for other types of vaccines other than that for COVID-19, older generations do tend to show less of certain side effects from receiving the vaccine. So when we talk about these side effects, it's okay to not have side effects, or it's okay to still have side effects for any other age groups. It does not necessarily mean that they are stronger in their protection or less in their protection.
Right, so there is no need to generalize then. Dr. Tan, is it true that receiving an mRNA vaccine on your right arm reduces the risk of myocarditis and pericarditis?
Absolutely untrue. So this is a superstition. I don't know where it came from. Some people think that it has something to do with the location of your arms relative to your heart. But I mean, it's anatomically, that doesn't make any sense, because your heart is pretty much in the center of your chest, equidistant from either your left or right arm. Also, this, mRNA vaccines and all the vaccines are intramuscular. They're not injected into a vein. They're intramuscular, and from there they go into the cells. From the cells, the proteins are released, and those go into the lymphatic system. They're then taken up by the lymph nodes. So there's absolutely no anatomic basis, mechanistic basis for this misinformation. Also, in terms of myocarditis and pericarditis, we think that the underlying pathophysiology, so the reason behind this phenomenon, is sort of a systemic immune response, not really related to anything that's happening in a particular arm. So absolutely not true.
Right, and it is also very rare for you to experience myocarditis or pericarditis after COVID-19 inoculation.
Yes, very rare. And I should say 9 out of 10 people do not have any symptoms after COVID-19 vaccination.
Right, that is
so you're
good to
in
know.
the majority.
All right. Also, Dr. Dan, some people claim that only certain painkillers can be taken to ease inoculation-related discomforts like a headache or muscle ache. Is this true?
No, there's no brand superiority when it comes to alleviating the symptoms after vaccination. So we recommend taking acetaminophen in any form, generic or brand name, it doesn't matter. Or you can use a non-steroidal anti-inflammatory drug such as ibuprofen or even aspirin. So there's no preference really for one over the other. And I think there's some perhaps internet articles about a particular brand being superior, but that's absolutely not true.
Right. What about drinking coffee after COVID-19 vaccination?
Well, if you develop a fever, as your side effect, in general, we recommend trying to stay well hydrated. And if you take a beverage such as coffee or tea that can act as a diuretic, that could actually lead to dehydration. So that's why in general we say if you have a fever, you should avoid drinking coffee and try to drink other fluids such as water that's going to keep you well hydrated.
Right. Professor Kwok, given concerns of breakthrough infections, a growing number of fully vaccinated people are seeking COVID-19 antibody screenings through the use of self-test kits, which are no longer being sold at local pharmacies, of course. How accurate now are these self-test kits?
Right. So when they first came out, they claimed to have very high accuracies. They were showing up to about 95% of its specificity and sensitivity. But given that those antibody testing kits were developed based on the original strain of these viruses, and they were not neutralizing antibodies they were detecting, but rather morphological structure that they created the antibodies to. Now, having said that, there were some mishaps and that could confuse general public when they were given to be in use by the unprofessional people, because I've actually done it on myself about 5 to 6 times. I've actually noticed every time it deferred in the time for the antibody to show up. So some people could come up with the antibody level, let's say 30 to 40 minutes later, but we would consider that insignificant because it has to be detected within 30 seconds to 3 minutes. Not only that, so it's a issue with the professional use of it. Number two, because it's not a neutralizing antibody that they're detecting, whether or not it actually detects an antibody does not necessarily equate to the protection level the person is having against the virus. So some people actually told me when they came into my clinic that if they detected antibody in the kit, they would decide not to go on with their vaccine schedule further. So I had to explain to them that this does not mean a full protection from the inoculation against the virus. So that's further why it was taken off of the OTC level, but it's now only being used by professionals. But when people come into my clinic to have antibody testing to test themselves if they have immunity or not, I clearly explain to them this does not necessarily mean 100% of the protection. Even if somebody was to come out with antibody, he may or may not still be protected from the virus.
Right. I have another true or false question, Professor Kwok. Some people are saying that getting either the COVID-19 vaccine or the seasonal vaccine will be enough to protect you from a possible twindemic. Are they right?
Absolutely not. So it's the twindemic. When people receive a certain type of vaccine, it makes them feel that they're boosted in their immunity against any sorts of viruses, and that is entirely not true. Any kinds of vaccines, they're specifically designed for a particular virus. And for example, in this case, a vaccine against COVID-19 versus vaccine against influenza is completely different in the senses of manufacturing, coming up with designs, and also the types of viruses they're attacking against. So if a person was to have received COVID-19 vaccine, he would definitely not still be protected against influenza virus and vice versa. So having received any one of the vaccines to be protected from the twindemic, it's only partially true, but absolutely not true against both of the cases.
So you need to get both the COVID-19 vaccine and the seasonal flu vaccine?
Absolutely, and you can receive both at the same time as well.
On the same day? Right. Dr. Dan, is it necessary to get the seasonal flu vaccine this year if one got that vaccine last year?
Yes, so in terms of the durability of the seasonal flu vaccine, it only lasts maybe 6 to 8 months, 1 year at the most. And so if you got the vaccine last year, it will have worn off by now. Also, the formulation for the seasonal influenza vaccine changes every year. There's something called antigenic drift that goes on. So the influenza virus, it mutates. We've seen this with the SARS-CoV-2 virus, right? It mutates, and so we need to come up with a new formulation for the seasonal flu vaccine every year. And so just because you got one last year does not mean that this protection is going to go into this season. And so if you are a healthcare worker or you're in a high-risk group, such as pregnant women, children, you have a chronic medical condition, you definitely should get the influenza vaccine again this year.
Right. And Dr. Dan, we've been told that the wearing of face masks last winter saw a tangible reduction in the number of flu patients for last winter. If I plan on wearing my face mask every day, all the time, do I not need to take the flu vaccine?
Well, so there are what we call non-pharmaceutical interventions, such as wearing a mask, washing your hands, keeping social distancing. These have all worked very well. We dodged the bullet against a flu epidemic last year. We also managed to decrease the prevalence of a lot of respiratory illnesses, such as chickenpox and other diseases that can be passed through respiratory droplets. So it does work, but the best way to protect yourself against influenza is to get the vaccine. It's free, it's available. I highly recommend it.
Right. Moving on, Professor Kwaks, come November, one will need to prove that he or she has been vaccinated or is uninfected with COVID-19 to access certain venues. Could you tell us a bit about these venues and about the people who will need to submit these verifications?
Right, so main theme of this plan is that they want to use sort of the vaccine pass system for anybody who's willing to go into a confined space, especially namely those heavily populated spaces such as gyms, restaurants, or nursing homes per se. So they are going to be required to show their vaccine passes when they're entering these venues. But if they haven't completed or haven't gotten their vaccines, they're supposed to come up with proof that they are negative through the RT-PCR method of the COVID-19 disease. But the thing is, COVID-19 RT-PCR test is only valid for about 2 to 3 days. So they would have to get their test done every 48 hours or 2 to 3 days to be able to use these venues. Now, also people who are exempted from receiving vaccines or not exactly mandated to show the proof of negativity if they are either underage, such as under 18 years of age, or they have not gotten vaccine due to medical reasons. But I think the government is still discussing whether or not to go ahead with that particular plan, because there are still chances for these two people to be either infected or to transmit to other people. Now, medical sector is another important issue that we have to discuss here. For regular general medical sectors, I think they're going to implement the vaccine pass system, which they haven't before, but that does not mean that people who needs medical care without passes or inoculation or the RT-PCR result could not access. So it means that per case, if it becomes necessary for them to enter the venue, they will still be led into the hospital, especially in the emergency room setting. Even currently, we test those people who are being suspicious of having COVID-19 to be isolated until they're proven of negativity of COVID-19 until they're properly treated. So all these sectors are currently being cared completely right now, but starting in November, we're also going to utilize vaccine passes to have access to these certain venues.
Healthcare facilities then?
Healthcare facilities as well as other confined spaces such as singing rooms and bars and restaurants.
And with the option, of course, of a negative PCR test?
Absolutely.
If my daughter had a problem, let's say she was not feeling well, and she had to come see you at your clinic, would she have to be fully vaccinated in order to meet you?
Well, if she's under 18, she's exempted. You know, if she is under 18, she's exempted from all those mandates. But if she happens to be an adult who hasn't been vaccinated, then she would need to come up with the proof that she is negative of the disease.
Right. Dr. Dan, I believe you were in the US for quite a while before recently returning to Korea. Do compare for us the use of such verifications over in the US and here on the local front.
Well, right now, we're not, we don't have a vaccine pass system, but I was in Washington State, I think starting October 25th, so not that long ago. The state has mandated that in order to enter into a restaurant, you had to show proof of vaccination. And in California, where my daughters are, one of my daughters tried to go to a social event on campus. It was just a party, and they were very strict. They said they needed to see the original vaccination document. A photograph was not accepted, and basically she was denied entry. But it's not just proof of vaccination. I think in terms of the private sector, there are many companies now that are requiring vaccination for employment. For example, United Airlines, they have required full vaccination to be employed at their company. And and they ended up firing 1% of their workforce, people who refused to get vaccinated. And so it's not just from a government perspective, but from the private sector as well. People realize that if you are unvaccinated, you can be a liability, a healthcare liability, but also financial liability to the institution or the group that you're entering. And so vaccine passes are being implemented, and also you need to show proof of vaccination to continue employment in many instances.
Right. Currently, Dr. Dan, here in Korea, COVID-19 tests are free of charge, but there is talk that that might change as we transition out of the pandemic. What is it like elsewhere?
Well, just like vaccinations, testing is such a crucial component to getting COVID-19, under control. And when we want to have a public health measure that we want a lot of people to participate in, we need to eliminate any obstacles, facilitate the process as much as possible. So we want to make it free, we want to make it accessible, easy, to get to. And so in the United States, anyone can go for a COVID PCR test, really free of charge. They have a lot of drive-through centers still, and it's very easy to get this done. No questions asked. You just register and it's done. I think for the time being, having a free testing program is going to be very important. If we start to have these obstacles to getting vaccinated or to getting tested, it's just going to undermine our public health strategy.
Right. Professor Kwak, what, meanwhile, are some issues to consider amid efforts to expand COVID-19 inoculations to younger children aged between 5 and 11, in your view?
Well, I'll be quite frank with you. I have children who are from 5 to 9 years of age, 3 children actually. The U.S. is currently talking about, well, not currently talking about, they're implementing their plans to actually inoculate children of those ages as well. The fact is that Pfizer and Moderna, they are reducing their dosages for when it is inoculated to children under 12 years of age. The dosage exactly is about 1/3 of the dosage that'll be inoculated to the adults. They're adjusting the dosage probably because of the metabolism issue and also their body weights according to their body weights. I would ponder myself quite for a long time before going ahead with inoculation to my children, but at least for the time being, I clearly know that it helps them, it protects them. So I guess probably after brief thinking, I would definitely decide to inoculate my children if given the chances. I just don't know how soon Korea will follow the steps of the FDA to actually allow, or at least for the emergency use, for the children to be inoculated as well.
Professor Kwak, speaking as an ordinary person, I wonder what you can tell me about how dosages appear to depend on a person's age or a child's age instead of a child's weight, I would think.
Well, for some medications, actually, they do depend on body weight. But some other cases, they have a completely different functionality of metabolisms compared to adults. They don't have the fully grown liver. They don't have fully grown kidneys yet to metabolize the medications and let out the remaining particles. So that's further why they differ either dosages or even types of medications when it's applied to different ages.
I see. All right, Professor Kwak, as always, thank you very much for your thoughts. And Dr. Dan, it's been a pleasure.
Thank you.
Right, and with that, we end this edition of the Daily Report. We'll be back same time Friday. Join us then. Thank you for now.
In Jeollabuk-do, Korea in May 2023. The world's biggest sports for all festival, Asia Pacific Masters Games 2023, Jeollabuk, Korea. In May 2023, the champion's glory is yours. Enjoy sports